Coughing, sneezing, and wheezing, well, these are all the symptoms related to allergies and asthma. But what is the relation between the two and how can we control it? Well, we chat to Dr. Fazile Mkhize to help break it down for us. Welcome, Doc. Thank you so much for taking the time to answer all of our questions this morning.
Hey guys, always so good to see you. I feel like I'm seeing you guys more than Tabs and the rest of them, but I mean, that's a good thing.
Well, luckily it's not in your practice, you know what I mean, or in a hospital or anything like that, so from this side of the screen. While we start unpacking this topic, let's start first by explaining exactly what is asthma and what are allergies exactly.
So when we talk about allergies, we're actually talking about an exaggerated immune response to what we would see as everyday materials. We call them allergens, but things like dust, pollen, things even as simple as bedbug bites can actually cause your immune system to have an overreaction and thus have a lot of the symptoms or disease profiles that we know. So you're talking about kind of the runny nose, allergic rhinitis, or you can even have the itchy skin that's also there, which we call pruritus, itchy eyes, conjunctivitis. So all of it is an immune response that's actually been highly upregulated to something that other people generally wouldn't have a response to. And then if we're talking about asthma, asthma is kind of under that umbrella because you can have an allergic asthma, but it's something that about 5% of the population suffer from, and it's essentially your airways. It's like a reaction that's happening in your lower airways where you have the lining that's there within the smaller kind of airway segments as well as the muscles reacting due to chronic inflammation that's there. We don't exactly know the cause, but we do know that there's some genetic components as well as some environmental components. So where you stay as well. Potentially if you stay closer to a factory, if you have children that are closer to fields where there's flowers, then that can also kind of affect whether or not they have asthma as children.
So if I'm understanding correctly, then a cough as a symptom would be a way of your body ejecting that stimulus or that buildup of the mucus. So it's trying to say, I don't want this in my body and I need to get it out, and therefore that's how the cough happens.
I actually feel like you don't need me anymore yet. I can send you through like a pack of scrubs.
No. Well, let's kind of try and also unpack the treatments that are available. I mean, things like nebulizers and humidifiers. Do these help in any way?
Those essentially are aerosol medication that actually goes into the lungs. When we're talking about nebulizers, even the sprays that you have, and they, depending on what the active chemical is, either will help relax the muscles that I was telling you about that line your lower airways down in your lungs. So by relaxing them, it increases that area, that diameter for air to then come in and out, as well as some of them actually help with dissolving some of the mucus so it isn't as thick, so that you're actually able to expel it out rather than have it clogging up a lot of the segments in the airways that are there. So a humidifier that will regulate the amount of moisture that's in the air also helps. So those are kind of things that you can do at home.
True story, though. When I was growing up, I used to have very bad asthma, and about when I was 16 or so, it just went away. For some people, they're not as fortunate as I was. What are some other ways, they can manage and maybe control these attacks?
So it's always important to, especially if you're thinking that your child has asthma, or you as an adult think that you might have had kind of asthma-like symptoms, to go see some medical practitioner in the medical field, just so they can do an assessment and see. So some people do have milder symptoms, and some people can go all the way to having full-blown attacks where they can't actually breathe. And it's good for you to be stratified on that spectrum. And once we've actually seen where you lie, then we can tell you certain things that can help you. And generally, it's always about identifying what your allergen is, what your trigger is. And once you understand what that is, trying as best as you can to avoid it. And if you really can't avoid it, we then start giving medication and adjust it in a stepwise approach. So we give you kind of step 1, step 2, step 3, depending on how well you did on the assessments that we gave you, as well as how bad your symptoms are when you get the attack.
Well, some insightful medical information there, straight from Dr. Fazile Mkhize. Thank you very much, man.
Guys, thank you as always. I really do feel like these are very helpful, and once again, my patients are saying thank you so much for having me on here. I think they kind of don't want me to see them clearly because they're happy with me being here instead of going and seeing them there.
Oh, we look forward to chatting to you next time. And of course, we've been talking about managing all kinds of symptoms, and managing a wet cough can be very uncomfortable to deal with. But DILINCT Junior is specially formulated for alleviating wet coughs in young children. It's tartrazine and alcohol-free and recommended for children 2 years and older.
DILINCT Junior clears a wet cough and thins and loosens chest mucus, suitable for children from the age of 2 years.